Hello people! Hey guys, welcome to my channel. My name's Kalista. I'm a third year medical student at Imperial College in London, and I thought I'd start this YouTube channel just so I could talk more about what it's like being a medic, living in London, and share all that with you guys. So today I thought I'd start by talking about what the structure of medical school is like and a bit about how third year is going. So in the UK, the medical course is the MBBS course, which is a 5-year degree, and you'd come out of high school, or like year 13 basically, and then go straight into medical school. For some universities, like Imperial, UCL, I know Oxford do as well, it's a 6-year degree, and the only difference is that we take an extra year out in the middle to do a degree that's outside of medicine. So each university offers obviously different courses. At Imperial, we have like 20 or so courses to choose from like neuroscience, so like anesthetics, bioengineering, management, but we also have the option to apply externally, so we can apply to other universities to do this course as well. And likewise, there are a lot of students who come into Imperial every year and join us for our intercalated degree. So that's basically the only thing that differentiates a 5-year and a 6-year course. And of those 5 years of medical school, it tends to be separated into two main parts. So you'd have the first 2 years, which are your more lecture-based, people like to call preclinical years. And then you have your latter 3, which are your placement years. So when you're on wards in the hospitals, really shadowing doctors and all that stuff. Most of the universities who do a 6-year course tend to put their intercalated year in the middle, but Imperial likes to be a bit quirky sometimes. So we do our 2 years of lectures, we do then our first year of clinical year, which is the year I'm in right now, and then we do our intercalated year, and then we finish off with our last 2 years, which obviously doesn't really make a difference, it's just rejigged, but it's kind of cool that we do it that way, because then I get to be in hospitals a little bit earlier, which is super fun because I guess that's what you kind of sign up to do when you decide or apply to go into medical school and not really sit in lectures all day. So yeah, now I'm currently in my 3rd year. We have 3 blocks throughout the whole year, so 3 blocks of 8 weeks. So we have 1 block of medicine, 1 block of surgery, and 1 block in GP clinics. And this obviously differs between different people. So I had my GP first, and then I'm doing my medicine right now, and then my next 8 blocks is going to be in surgery. And so we're kind of rotated between different hospitals, but for each of the blocks you're in 1 hospital for the full 8 weeks. And then usually within the blocks, you tend to have 2 different firms. So for example, right now in medicine, my first firm was acute. So I was in acute for 4 weeks, and then I'll be on rest for the next 4 weeks. So you're not really stuck on one firm for the whole 8 weeks, but instead you're kind of moved around a little bit, which I guess makes things a lot more interesting. The way clinical years work at Imperial is you essentially have sign-offs for your hospital placement. So when you're on wards, you'll be shadowing the Ep1s, the ward round doctors, nurses, a bunch of different people. You're just kind of operating within the ward. You have a list of, I think it might be like 20 to 30 sign-offs that you have to do throughout the year. So that runs across all 3 blocks of placement in 3rd year. And you basically have to sign these skills off as you go along. And people do it in their own time. So basically by the end of the year, you'd have to sign off all the different sign-offs that you're required to do. So some examples are like cannulation. There are a bunch of examinations you have to get signed off on as well. So like an abdominal exam or resp exam, like taking history and like talking to patients and all that stuff. But alongside all of this, we have a list of around almost 300 conditions that we have to learn. So it'd be like hemorrhages or myocardial infarctions or like eczema. So basically we have to know if patients, for example, have those conditions, how they present into clinics or into hospitals, how we diagnose that, what things we have to use to investigate it, how to manage it. You obviously have to go to placement during the day as well, and you kind of have to juggle that and learning all the different conditions. But I think what the most frustrating thing was for a lot of us was everyone kind of had their own method of studying and their own method of doing things already from the first 2 years. Which was like our more like lecture or like preclinical years. Back then, everything was given to us, so everything we need to know would be on lecture slides. Like, we'd go to lecture, we'd learn whatever was on the slides, and then we'd like show up for exams basically. But I think this year things kind of worked a little bit differently because no one was teaching us anymore per se. A lot of the times we were learning from a list. Basically, we had to self-study, we had to find things out on our own, read textbooks, read different websites. And I think that kind of messed with me a little bit at the start. It was a bit overwhelming because there were so many conditions that I had to go through. What the most helpful thing was, we had a lot of help from the older years. So we have a note bank where older years kind of put their advice or, put their notes onto, and seeing their notes and how they did things, it kind of made more sense to me as to how I wanted to approach the year. I think third year is generally the year people enjoy the most, just because, well, firstly, you have a lot more time in hospital, because in our first and second year, we did things in 2-week blocks. So in our first year, we had 1 2-week block of just being in medicine, speaking to patients, just understanding how things work in the hospital. And then we had 2 2-week blocks in second year where it was more the same things. But then now into third year, we have more of an agenda we need to follow. Like, we have to get all the sign-offs done, but we also spend more time on the wards, so we get to know people a lot better and we get to know the patients as well. And I think that's super cool because you can follow the patient journey, being able to see the different complications that happen on the wards and kind of how the team manages that. Those are things you can't really get from being on the wards short term. Throughout the whole year, not only on the wards speaking to patients and all that stuff and learning your conditions, whatever, we also get taught a lot of clinical skills as well, which is nice to have practice on. So like suturing or like trying venipuncture and stuff on mannequin. A lot of the times it can be a bit intimidating walking to the ward and kind of not knowing what everything is at first. Or like you need to get skills done, but you don't really know how to approach them. And a lot of the times, people are busy on the wards, doctors are busy as well. Like, they don't always have the time to walk through things step by step. But having these clinical skills is always really nice because then we can practice, we can make mistakes, we can ask questions and stuff like that, and we get taught, how to do it properly. So when we actually do step onto the wards, it makes it like a little bit easier. When we do on patients the first time, it makes it a little less intimidating than I guess it would be. I think the start of third year was a little intense just because I wasn't entirely sure how to approach the year. October, November tends to be a busy time because societies tend to have their events around those times. Going into my second block, things made more sense. I kind of had a way of doing things already, so things definitely became a lot easier. But I guess it's also just because it's quieter in second term. There aren't as many events and stuff going on, so you're just not as stressed about all these things as well as your degree. Thank you so much for joining me in my first YouTube video. I hope you guys enjoyed. Do let me know if you guys want more of this kind of content or other stuff. I think I'm going to be speaking a little bit more about kind of like life at Imperial, my school life, and all these different stuff. But do let me know what you guys want to see as well. Yeah.